Good morning. I've been getting a lot of questions lately in my inbox about the wax try-in, and I did a video about this a while back, but as you know, with this algorithm, things get pushed out and then they get lost. So I'm gonna start to repeat some videos and just do them anew. So today I thought it would be nice if I just went through step by step the form that I and a patient came up with together several years ago to tell the patient what to look for with a wax try-in. Something that the patient could understand, and also wanted to stress how important that appointment is. So here we go. Informed acceptance of dentures at wax try-in. What is a wax try-in? A wax try-in is a preliminary viewing of your dentures with the teeth set in a gum-colored wax. It is used by the patient and the denturist to evaluate and achieve the desired appearance of the final denture before the final denture is made. Why is this step so important? The wax try-in step is the point at which any changes to the appearance of the teeth can be made easily. But once the wax try-in has been approved by the patient, the final denture will be processed, completed, directly from the wax denture. The completed denture cannot be adjusted for appearance again after it's processed. It is very important that the patient make sure the appearance of the denture teeth, the teeth and the pink acrylic gum area are completely satisfactory at the wax try-in appointment. What is our office policy? We encourage patients to take their time and address any questions at the wax try-in appointment or appointments to ensure satisfactory results. We recommend that they bring a family member or a friend and have them accompany them to evaluate the wax try-in appointment. When a patient has approved the look at the wax try-in appointment and the final denture is made, we cannot change or remake a final denture due to the patient's dissatisfaction with the appearance of the denture without an additional fee being charged. I stress this because when it is set in wax, anything can be changed. But once it's approved, it's processed into acrylic, and then you cannot move those teeth around. You can shave down areas, but you cannot rearrange those teeth once it is processed in the acrylic. Okay, now these are the disclosures that the patient signs for, only when they're satisfied. Patient has had the opportunity to evaluate the denture's appearance at the wax try-in stage and is satisfied with all of the following. Number 1, the color of the denture teeth. The shade is not too light or too dark. Number 2, the size of each denture tooth. The width and length is not too big or too small. Number 3, the amount that the denture teeth show when you smile. The teeth don't show too much or too little. Number 4, the fullness of the lip support. The lip is not too full or too sunken. Number 5, the overlap of the front teeth. The upper and lower teeth bite together the way that I like. Patient approves of the denture's appearance at the wax try-in stage and understands that the appearance will be the same as in the completed final denture. Patient understands that additional fees will be charged for changes or remakes of the final denture if any requests for changes involving the appearance are made by the patient. So, once it's processed and finalized, the patient is not happy with the way that they look, I'm going to charge them. Eyeball these things. Make sure that midline bisects the middle of your face. Be picky. Don't sign off, and don't say you're happy if you're not. Be picky. Make sure that you have a positive smile line. A positive smile line is this, that the teeth should follow the curvature of your smile. So when you're smiling and looking in the mirror, you shouldn't have your teeth go downward like this or sideways, tilted in any way. You want to make sure that they follow your smile line. You want to make sure that when you put your teeth together in the closed position, that they line up perfectly together, the upper and lower dentures like this. And you should not have to be trying to put them there. That is an instinctual movement. When you close your teeth together, they need to be together, not trying to find it. That is the bite that is so important. If you don't have a good bite, the denture's not gonna work right. So check that bite. You want to make sure, obviously, that you have good lip support, especially my ladies out there. We get these fine lines and wrinkles when we're older, like I have. And sometimes having a little bit of fullness right here can kind of pooch that out, give you a little bit of Botox effect. So look at those things and make sure that you're telling the provider, these are the things that I want. Like if you don't want your teeth perfectly straight, tell the provider, I want them a little bit tilted, I want them a little bit more prominent on the canines if that's what you want. Be sure that you express all of your desires to your provider. If you have any questions, want further clarifications, drop some comments. All right, guys, have a great day. Bye-bye.